welcome everybody. My name is Bahae Samhan. I'm the second author. I'm here along with Majid. Our supervisor, Katie Joshi, couldn't make it, and we're going to be presenting on her behalf. We're from Washington State University, located in Pullman, Washington. We're going to be talking about mobile health information technology and patient care. This paper actually was a result of our first seminar, our first year. We just completed our first year as doctoral students. And I come from a computer science and telecom background, and I was first introduced to the health IT at this seminar. We found a lot of interest in it, and we thought that you might want to read more about it. And one thing led to another, and then we thought, okay, what we're doing, why don't we do a literature review about it? So we consider this paper as a good guide for future research. It combines a lot of information that could be helpful to move on, as I'm going to be talking about a few next slides. So, why did we choose the mobile health information IT? We noticed that patient-centered care has gained more interest from care providers, where instead of just looking at the IT being provided in healthcare, how efficient it's going to be, or how accurate it's going to be, at least, they're now focusing more into the patient care. How would this leverage the care towards patients? That is for the HIT. And then we realized that mobility could actually increase that level of care towards patients. So adding mobility to our HIT would facilitate the goal of having better care for patients. So we wanted to see the mobile IT effect on healthcare. It's a new field, and as you're going to be seeing, we realized that it's under-researched, at least in the US, I would say. I know that it's a worldwide thing, but we're looking at the US papers, and it's under-researched. There's a lot of investments that could be put into toward having mobile HIT. And we wanted to look at the impact of mobile on HIT. So our first objective was to look into the extant literature. We looked at, it was basically a literature review, so we looked into most of the publications in the top journals. The three parts that we looked into, the first one was mobile. Second part was the healthcare, and the third component was IT. And obviously, this intersection is where we are looking into. We need mobile, healthcare, and IT. So this was our main focus. Looking into the literature, we found a lot of the papers that were irrelevant papers, and those are the ones that were talking about mobile and IT, and basically those are the technical papers. They have nothing to do with healthcare. Obviously, the most relevant papers are the one at the intersection. So we started our process by first, of course, because it's a seminar paper, we proposed our idea. Second, we started going into the databases and searching for current literature. We looked into the keywords mobile, healthcare, information technology, and patient care. Mobile was defined differently in many papers, and this was interesting, and we mentioned that in our manuscript. Some papers were looking at mobility as wireless technology, like Wi-Fi, 3G, 4G. Some of them were looking at it as a mobile device. Other papers were just talking about mobile as just being mobile, able to move. Like I remember an example with a healthcare van that provides healthcare to rural areas. So they refer to mobile as the car because it's being mobile. It has no technology on it. So everybody was defining mobile in a different way. And we found very few papers resulting using the keyword patient care. So in one of actually our searches, we had to take out patient care to find more results, which might be a first indication that this is a new area. It's under research. Then we started coding the articles, basically summarizing whatever we had, and then we synthesized our results. Majid's going to be talking about that in a little bit. And then eventually we got that manuscript, which is our article. So we mentioned the keywords that we searched. We looked into the databases. We found 133 papers out of these databases, which come up with these numbers. We looked into the abstract and the title. Okay, and after we got the results, we divided these into 3 categories. The first category was mobile healthcare information technology. And again, if you remember, this is the intersection of all 3 components, and that's the most relevant papers. The second category was the IS and IT journals, healthcare and IT. And the third were the irrelevant papers that we're talking about only mobility and ITIS, or technical papers. This word cloud, I'm pretty sure everybody's familiar with it, has been developed after taking out the keywords, just to get a feel of the main themes. So again, Majid is going to be talking about those themes. We have monitoring, we have use privacy. Those are mainly themes that have been discussed in the papers. So outcomes that we're looking at is the current status of mobile IT in the current literature. And again, we figured out that it's under research. We came up with the emerging themes, and I'm going to be talking later on the future agenda for the research. I'm going to leave it now for Majid to continue on these.
So this is the table of the themes that we came up with. We looked into the research findings, research settings, the papers, methodology that we use, methods that we use, and we clustered the papers into 9 themes. And the themes are in this table, and kind of they're summarized here in the description, but later on in the next slide, we'll talk about it more in detail. So the themes are we'll use HIT communication, communication with patients, and healthcare, which is health data, SI system integration, HIT success, HIT value, and health delivery, patient monitoring, patient workflow, and privacy security of patient data, which is privacy security. We just named it that way to make it shorter. So this is the table, and we also have another table by methods that we have summarized the themes by method. So what methods are using what themes? So here, for example, we can see that like 32% of the papers have used are conceptual papers. So that means they are like opinions. There is no data collection in those papers. And the least method that has been used is the simulations. Is archival data, which is like the 2% of the papers just have used that kind of method. So looking at the table, we can say for the future research, we are suggesting that, for example, what methods can be used more in what themes? For example, we can use an HIT value. We can probably use more, if it's not conceptual, we can use more conceptual methods, or we can use more simulation if it fits into that theme. So this is another table, which is kind of the result of the study that we've done. So the first thing is both use HIT, which is about designing, implementing, adopting, and using ISTs in the healthcare industry. And as an example, we have, from these papers, they have focused on the use of HIT to examine the delivery of high-quality care at low cost. So this is just, these papers are an example of that theme. The next theme is communication with patients and health professionals. They looked at communication in different ways. Some of the papers have looked at it like the communication between nurses and doctors are very about like patients and relatives when patients are at hospital. So it's been looked at in different ways, and the example for this theme are the papers. This paper which looks at communication as an interaction among the main stakeholders of in healthcare, and they looked at communication that way, and to demonstrate that quality of interaction is enhanced through the use of mobile technologies. The theme number 3 is health data and system integration. Only 2 studies focused on the role of data and system integration within the context of healthcare, because there are so many issues in healthcare, because there are data are shared in different stations, and they are operated in different locations. So integrating that data and integrating that information system is a big issue in healthcare. But so for the future research, again, we are suggesting that more research should be done in that area in the healthcare and focusing on patient care. So as an example, Hashim and Ruggeri, they reported the effects of promoting integration from the infrastructure on the use of MHIT. Theme number 4 is HIT success. They looked at the papers under this theme are about the success and failure of the information systems technologies in the healthcare. For example, Addison and Young and Yakubo, they studied IT projects and they uncovered the failure factors. Theme number 4 is HIT value. It's about how mobile technologies would affect the benefits that are generated by healthcare organizations. And all these papers, they suggested that IT applications, technology, architecture, and mobile devices have significant impact on patient care. They will leverage patient care and patient care quality. And theme number 6 is mHealth delivery, which is Baha was talking about, the van. It's like physical delivery. There is no information technology involved in it. So we are again suggesting that studying this physical delivery of the healthcare to the rural areas or the lower income neighborhoods enabled by mobile technologies that was what we are suggesting, that more research can be done in that area. And the example is by Moulevi and et al. They offered guidelines for design and maintaining of vehicles, the physical vehicles, which can provide mobile healthcare services for the rural areas. Theme number 7 is patient monitoring, that how we can monitor patients at home, like elderly patients, aging people, and like those with chronic diseases. And an example was found et al. They suggested that using advanced biomedical sensors, using those kind of sensors, we can monitor the body condition of the patients at home. Theme number 8 is patient workflow, which is about like how MHIT can facilitate and optimize patient workflow in the hospitals. And the example is Bharadwaj and et al. They discussed that doctors are moving between the wards rapidly and taking care of the treatments for the patients. But using mobile technologies, it will be much easier for them to decide on the course of treatment appropriate for each patient. And theme number 9 is privacy security of patient data. The papers on this theme, they discuss the issues involving the privacy of patient data. So patients don't like to share the confidential medical records. So it's an issue, and also the systems that are supporting that kind of data is an issue again that are discussing these papers. For example, Rin Fleisch, he presents a discussion of the advantages, disadvantages, and hazards of a move to EPR or electronic patient records. Baha will conclude that presentation.
Yes. Going back to where we started, this is where we were actually focusing on, and this is where we found that there's a huge gap in the research. We knew that patient-centered care and MHIT is something that future researchers might a little bit elaborate on or probably work more on it. Maybe to address that gap, we suggest that they might look into interdisciplinary research, because we did not, and maybe they would find, I'm pretty sure in medicine journals, they might find a little bit more about MHIT. It's not going to be as technical, but it might address a little bit the gap that we have. The teams that Majid was explaining, some of them have covered all 3 components, mobile, IT, and healthcare. For example, the theme of communication and monitoring, that one would, or those 2 would cover all 3. Some did not, such as patient records and privacy. Those did not cover all 3. It is also possible that during our research we then covered every single article that was there. We might have missed some of those articles. So maybe if you read the original manuscript and look at the papers that we looked into, and maybe look more into more data exists. So our conclusion is that we call on researchers to look more into the intersection of those 3 components. Thank you, and if you have any questions.
Thank you very much for that.
Thank you.
Questions, comments, maybe suggestions for the presenters as they move forward in the area? I think they're just starting off with Dr. Stevens.
That is true.
I have one comment, and that was, we heard earlier today the comment that we've stopped using the word patient, and we're now using the word client, so that patient care might be something
Like,
that
probably.
you're not going to find.
Yeah. Do we concern fines?
No, I mean, you're not gonna find client care, you just stick with healthcare.
Okay.
I think that's,
Maybe would help in the research. Yeah, thank you.
So, yeah, thanks.
So you include PubMed and Cochrane, the databases. What was your criteria in deciding that?
Well, we try to cover medical databases and also information IT databases too, because to have all the papers from medical field and also.
To include PubMed?
Sorry?
No, PubMed we don't look
I
at.
think they have to know, so, but that will cover other things.
Yeah, that's true.
Jamie will show up. So Jamie
I
has
have
showed
it
up
somewhere.
somewhere.
So those are the databases we look at.
And
Medline, yeah, they got it, Medline.
Yeah.
That will cover.
also another one, the theme, you use mobile health and, what's the other one? Mobile health and.
Delivery.
The last-
Delivery?
The last,
You mean-
the last, slide, please.
The last
Those are the
thing.
themes. So.
Okay, I mean, the broad categorization of the theme. I mean,
the keyword?
please, if we have more articles, maybe you will end up having more themes, you know, I mean,
That's-
eventually
yeah,
you
of
get
course,
saturated with the theme.
That's what when we were trying, we tried them in different fields. Like when we were searching, we tried to put keywords in different places, like abstract, title, and like having patient care, removing patient care, what kind of papers we get. So
Mobility, taking out mobility.
just
we
to
got
have
that.
it like as comprehensive as possible.
I know, I mean, don't you think it's better to put the component of the information technology in that field and then just categorize it under those four components, hardware and software, people, data information, regulation, policy, and then data and communication and network.
That might be a different paper. Yeah, I mean,
No, I mean, all of these things, actually, we put
Yeah.
it in one of the.
Maybe.
sections.
Yeah. That's a good idea. Yeah.
Well, I appreciate this slide, very comprehensive
Thank you.
study showing how mobile HIT can generate impacts on healthcare. With my understanding, current issue is not HIT, not MHIT. It's a resistance from the healthcare professionals. So your final slide is the most critical one. If we continue to look at the technology, it's not going to work. We have to really go to the cave of the physicians and nurses, humble down ourselves to understand what they really care. And if that's the starting point, then we will really be very, very humble to learn from them and provide what they want. And this is my 3 years finding. I really tell you that the problem is not IT or HIT or MHIT. The problem is their willingness to let you touch their nerve.
Yeah, and this is our first paper in this field, and so maybe we might consider that like as we go on. So,
Well,
yeah.
well, Washington State certainly, has many places you can
Yeah.
go. But Washington, I was there, but I don't know Washington State has a medical organization. Certainly UW has, UW is very top.
Well, Spokane is also a hub of the
Yeah.
medical hospitals.
I was there, 15 years ago. I do believe that you guys represent the next 15 years scholars, so you have to go to their medical facility to understand what they really care.
Thank you.
Any other questions? Advices? So I think now you have to sort of go forward and sort of fine tune and think about what to do next. And certainly mHealth or MHRT is a blue ocean area.
It is.
So it's a good area, maybe to find something for focusing your PhDs in. And good luck. And hopefully this is not your last paper in healthcare.
Hope not too. Thanks.
Thank you.
Thank you.
Okay.